This is the next case in the Randomized Interesting Cases series, a 50-year-old male with hypertension and diffuse abdominal pain. We have here some portal venous phase axial images from a CT abdomen pelvis, and I'm just going to take some time to scroll through the abdomen and the pelvis. And you might have noticed in the centre of the abdomen, based within the mesentery, there is this mass, quite an irregularly shaped mass, really at the root of some of these small bowel mesenteric loops, and we can see this soft tissue extending up the vessels into each of these leaflets of mesentery here. You get the impression along these vessels as they fan out, suggesting a degree of surrounding desmoplastic reaction. It looks like this mass is enhancing. We can look at our non-contrast images to confirm that, and we do see a difference there in attenuation, suggesting enhancement. And we can also see on our non-contrast images a little spot of calcification there. So let's have a think about what this might represent. Let's have a chat with RadChat. Differential for partially calcified mesenteric mass with surrounding desmoplastic reaction. Okay, so it's giving us some differentials here. It's suggesting carcinoid tumour is something we could think about, and I think that sounds like a very good idea. Usus adenocarcinoma can also present with calcification. Okay, could see some desmoplastic retraction or reaction. Sorry, retractile mesenteritis. Yeah, okay, and then probably some more rare conditions here to think about: amyloidoma, inflammatory pseudotumor in situ IgG4, and GIST. I wouldn't particularly expect it to look like this, as it's usually clearly attached to a loop of bowel. If we are thinking about carcinoid tumour here, what else should we look for in the scan? So let's help us. So primary tumour, yeah. So we can look for primary tumour if we're worried about carcinoid tumour, because this mesenteric mass we see wouldn't be the primary tumour. The primary tumour would actually lie within one of the kind of slightly upstream bowel loops. These can be really, really difficult to see on plain imaging studies, and as I very briefly scroll through the small bowel loops, I'm not seeing anything jumping out at me. Often this can be easier to see with subsequent nuclear medicine studies. So the mesenteric mass we've seen is a lymphadenopathy, and this is a useful checklist for us to go through. So I'm scrolling up in the mesentery, so upstream of this mass, to look for involvement of draining lymph nodes, and I'm not seeing anything concerning for lymphadenopathy. Liver metastases, these may enhance the contrast, particularly in the arterial phase. Okay, well, we have arterial phase imaging, so that would be useful to look at. And there we go, as we come towards the top of the liver, we can see, what's that, 1, 2, 3 areas of enhancement there, abnormal enhancement concerning for liver metastases, so that's good. Desmoplastic reaction and calcification we've already looked, and serosal implants. That could be interesting to think about. Perhaps we could go back to our portal venous phase images and look throughout the peritoneal cavity, looking for serosal implants. I haven't seen anyone. I've been looking at the scan. Okay, let's look at the rest of it. So we know about these liver enhancing liver lesions. We know where they are. It's good. Otherwise, things look pretty normal throughout the abdomen. So let's think about writing something. So let's say enhancing mesenteric mass with surrounding desmoplastic reaction. Or let's say enhancing mass within the small bowel mesentery and a small internal focus of calcification. We could say no lymphadenopathy, but what we really should say is multiple arterial enhancing liver lesions concerning or metastases, no lymphadenopathy or serosal disease. What else should we think about here? I think that's probably it. So let me say otherwise normal and generate report. So enhancing mass, small mesentery, focus calcification, other organs normal. Yep, we looked at lung bases and we looked at bone lesions, so that's good. Enhancing mesenteric mass suggested of primary mesenteric, so we can do better than that because we've had a bit of a think about suggested of a carcinoid tumour, multiple large enhanced liver mesenteric disease. Good, let's finish it there.